Obstructive sleep apnea, or OSA, is a very common sleep disorder that affects about 39 million Americans. Continuous positive airway pressure, or a CPAP, remains the gold standard treatment for OSA, but it's not the only one. A newer procedure and surgical device called Inspire can help. OSA happens when the muscles in the throat relax too much, causing the airways to narrow or close as you breathe in. Dr. Apnea Asarkar is an ENT physician, and he explains symptoms associated with OSA.
It's symptoms like tiredness in the morning, or fatigue during the daytime, or falling asleep while watching TV.
If left untreated, OSA can affect your quality of life and lead to diabetes or heart disease. If you've tried non-surgical options like wearing a CPAP and are unable to tolerate it or no longer use it, a hypoglossal nerve stimulator or the Inspire device may be an option. Inspire is a surgical implant that monitors your breathing while you sleep and opens your airway. The surgery has two parts and two incisions. One is the sensing lead and the other is the stimulation lead.
The sensing lead is the one that goes in the chest, which is going to sense the breath, and the stimulation lead that goes into the neck, which is going to send these minor impulses to the tongue muscles for it to move.
When the sensing lead in the chest detects the tongue obstructing the airway, the stimulation lead in the neck sends an impulse or a signal to the hypoglossal nerve that controls the tongue to help the patient breathe normally. Richard Humphreys was diagnosed with obstructive sleep apnea in 2012, and he used a CPAP for several years.
I heard about this new thing called Inspire, and I understand that it was FDA approved in 2014. I did my own research and decided, hey, this might be worth investigating.
Humphreys then completed a sleep study and a sleep endoscopy to determine if he was a candidate. After Medicare approval, he had the procedure in May of 2023.
It was painless. The only issue at all was temporary swelling.
Humphreys said the swelling went down in about 2 to 3 weeks, and after 30 days of healing, he went back for an appointment where the device was activated and Humphreys was given a remote to control the device.
This is key to the whole thing going forward. You manage this and you turn the device on before you fall asleep at night. You turn it off in the morning when you wake up.
Humphreys says it's been over a year now and they've got the device fine-tuned just right for him. Dr. Asarkar also said that they've in some cases been able to completely mitigate obstructive sleep apnea in many patients after implanting the device. This is an elective procedure, but Medicare and some private insurances will cover it if you can meet certain criteria. If you have obstructive sleep apnea and are wondering if you're a candidate for this procedure, check in with your primary care provider or an ENT physician.